Yes. I just feel like this is a roller coaster with this RFK thing. 2 months ago, we're excited that he's going to get nominated. A month later, now people are questioning if he's going to get confirmed.
When's the confirmation happening? Who's arguing this?
I don't even know. I think it's almost like 2 months away.
I thought he was already in, but he's not officially in.
He's not in.
Oh, God.
He's not in.
Oh,
So he needs to get, I believe, all but 3 of the Republican votes.
Okay.
So if 3 Republicans do not vote for him, then he's good. Okay. But if more than that, then that's a problem. Assuming all the Democrats say no.
Oh, don't
say no, right? That's my understanding. But right now, you have a group of, this is NBC News, more than 15,000 medical doctors sign a letter urging Senate to reject RFK as health secretary. Oh my goodness, which is terrible. I read that, and what their claim is that this is essentially a slap in the face to healthcare practitioners and science-based healthcare. I saw the letter, and here's what they're saying. Let me see if I can pull it up. The health and well-being of 336 million Americans depends on the leadership at HHS that prioritizes science, evidence-based medicine, and strengthening the integrity of our public health system. RFK is not only unqualified to lead this essential agency, he is actively dangerous.
Wow, dangerous.
As if
actively dangerous.
Right, actively dangerous, right? To a terrorist.
He's a terrorist.
As if our current healthcare system was thriving and it was getting people healthy.
Instead of when you go to other countries, you notice, oh, wow, they're way healthier than here.
Yeah.
So aren't we like considered the lowest health?
We, out of 11 developed countries, we're number 11 when it comes to healthcare outcomes. A few years ago, they did a study with 37 countries, and we were 37. So when it comes to health...
We're not doing so great here.
So explain that a little bit more, because people think of, the United States, and they're like, what do you mean? We have doctors, we have facilities, we have the technology. How come we're 37? So could you please explain, what are we, like, why are we 37 on paper, so people understand that?
Yeah, well, we have a great sick care system that does a great job of taking care of very sick people, meaning that we are very reactive. If you break a bone, you're gushing blood out of an artery.
We're good at that part.
We're very good at it, right?
We can get there quick, right? Like,
like if I'm about to die, I'd rather be in the United States than anywhere else in the world.
not like in Puerto Rico, it's 2 hours in ambulance.
Yeah, I'm dead in Puerto Rico. It's like,
dead in Puerto Rico.
Ma'am, you gotta pick the body.
That's a joke, actually.
Ma'am, you rather pick the body, take it to the hospital. He's still gonna be dead before the ambulance gets there. But we have a very good sick care system, but we have an inadequate healthcare system. We spend about $4.2 trillion every year in healthcare, which if you put it in perspective, if money was the solution to our health problems, we'd be the healthiest country in the world. Yet we're not. Our infant mortality rates, our maternal mortality rates are one of the worst of developed countries. And to put the cherry on top, our life expectancy is actively dropping. So when I see a letter from 15,000 medical doctors calling RFK actively dangerous and unqualified, my question is...
Compared to what?
Compared to what, right? Because your current healthcare system sucks. All the work that you guys done to this point, it's killing us. What's your solution to the problem? Like, who's the alternative?
Right.
Because if the alternative is out there, I'm not hearing much about them.
And no, I haven't seen over the last couple of decades, they've had different people in his role. Quite a few different people in this role, right?
Yeah.
And things haven't really changed.
No, if anything, they've gotten worse. They've gotten way worse. And on top of that, right, the picture of health, the health advocate in the United States for the last 4 years was probably Dr. Anthony Fauci, which
he looked sick.
He looked sick. He just pushes vaccines and tells people that vaccines are going to stop prevention, transmission, etc., which is not true. And now he was issued a presidential pardon, which if you're innocent, why would you accept the pardon?
Well, and wasn't the last person in RFK's future role, because I guess he's not in it yet, wasn't he severely overweight?
Yeah, they're overweight. Well,
Coming back to your point from another podcast.
no, here's the issue. So if you think about healthcare reform, right? Mm-hmm. The previous administration, whoever was in charge of this role before, they were tackling the wrong problems. They were tackling, number one, gender change, which is...
That's what they were tackling?
Yeah, that was one of the things.
How is that healthcare?
Like abortion and transgender, etc. Two things, which is, it might be healthcare for some people, but it's not the main thing right now. No. If people haven't read the news, cardiovascular disease is killing us right now. Cancer is number 2. Diabetes and obesity is probably 3 or 4. Mm-hmm. So we're tackling the wrong problems. Right. The second thing they were tackling is access to care, which I understand. However, access to medical care is not going to change completely our healthcare problems. It just means you're going to have more access to pills and surgery.
Right.
It's still not going to change the problem. The only way you change the current healthcare problem is making things healthy and safe.
So, for example, it's not going to help you not get cancer. It's just going to make your pills, once you get cancer, affordable.
Affordable. There you go.
So once you have it, then I'll give you the drugs, and the drugs are affordable, but you're not going to help them not get it. And what you're saying is, you're why are we jumping to there instead of fixing, not even getting it to start with? Then you don't even need the pills.
Start from the root, right? How do you change the paradigm, the current paradigm? So when I see these 50,000 advocates saying that RFK is actively dangerous, I'm questioning their integrity now, because I'm like, who's paying you? Do you think this is going to be an issue for your practice, for you making money for pharmaceutical? Because right now, I think RFK is actively dangerous in the sense that he's threatening Big Pharma and Big Food and government. That's when I see actively dangerous, those are the people that should be scared.
Do you think, do you believe that, or I should say, do you believe that it is possible to have an actual shift into natural health, or do you think things like this are going to prevent it? Do you think these doctors and the pharmaceutical company can prevent it, or you think it's people? Do you think the people can do it?
I honestly, right now, no. And the reason why, we can use other countries, for example, even, the medical oath, when people graduate, doctors graduate, right? I don't know the exact words, but don't they say something like, I'm here to help whomever, blah, blah, blah.
They have to take some kind of oath, don't they?
Huh?
They have to take some kind of oath to protect people. And
right. It doesn't matter whether someone is and they need help. Yeah. But it feels like in this country, we have walked away from that. And it's sad, because you go to other countries and someone needs help. It doesn't matter what kind of doctor you are, you're going to help this patient, right? Ability, Sometimes here in this country, I've heard horror stories of patients being like, I went to my doctor, I need this, but they said that they cannot treat me because my insurance doesn't cover.
Or my kid cannot get care of that pediatrician because he's not vaccinated.
Or yes, and then and little simple things like that, where when you hear it, you're like, I cannot believe that I'm hearing this. So it goes back to this corrupt system. So going back to someone like RFK that is battling, and doctors are against someone like him. I wonder why. It's not beneficiary for the system. Going back to answer your question, do I think it's gonna change? Not right now. But we can, the people that do believe in that the system needs to change, we're going to keep walking towards that. It doesn't matter who gets in the way, and it's going to be hard.
And you know what's even frustrating about this Kennedy issue is that there's a lot of people that are vocal about him, actively dangerous, going back to it. And the people that should be more excited about RFK are the people that are on the other side of the fence, the ones that take the vaccines, that consume the medications, that eat the Fruit Loops, because they're the ones eating that stuff. And if they're eating it, they'd rather have somebody that's making sure that the ingredients are in there are safe for you to consume. So those are the people. I'm not eating Fruit Loops. I'm not taking vaccines. I'm not taking those medications. I could care less what they put in those things, because I don't consume them. But the people that are consuming them should be more excited about RFK being in there, because now they're making sure that those are safe ingredients.
Lauren, I'm going to say it out there. I'm not vaccinated. I didn't get vaccinated for the whole COVID situation. But imagine now, 2025, we look back and let's say getting these vaccines really cut my chances of me getting pregnant in the future. Mm-hmm. And that gets proven, and someone invests the money and research to really find that, with numbers. Yes, that'll make me feel like this life is not worth it. And for some people and for some families and for some couples in society, I just heard in Puerto Rico right now, how do you call it? The percentage of babies
Fertility?
actually, or babies being born.
Birth rate.
Sorry. Has gone significantly low. And we can point and say a list of things as to why. Money, economy, education, whatever. But what if this is also, and it's one of the top 2 reasons why it's hard for people to become pregnant. Don't people get mad about something like that? This current system really messed up with me, my family, my future, my legacy. I'm just pissed.
Well, I'm pissed. Well, if RFK, and then problem, you cannot sue them. You can only sue the government essentially, and good luck going to court and proving that this vaccine actually messed up your ability to conceive. But even if RFK went in there and somehow they figure out how to remove immunity from these pharmaceutical companies, that is game changer. That is game changer. And I think that's what should happen. And I think these 15,000 MDs, I think their names should be out. I don't know if their names are out, but we'll look at them.
That's a relatively low number in comparison
compared to how many we have, though.
I agree. But you know what? All this makes me just think, people hate change. Even if change is for the good, they hate change, right?
They hate it.
And so it's been a long time to get to where our system is. And so to your point, and it says it probably is going to take a while to get it back. So my question then is, how can we as people who really just want the best for people and really want to project another side so people have a choice? You can pick whatever you want. If you want to take vaccines, take vaccines. If you want to eat unhealthy, eat unhealthy. But you should at least know and have facts from both sides, right? So how can an individual, right, who does care about that, what is the best thing, in your opinion, that they can do to help other people who may not know yet, who may be afraid of the change?
Yeah, I mean, you have to find common ground. It's not like all the people that walk into our practice, they have a natural lifestyle and they're excited
Probably
about.
A lot of them don't.
Most of them they don't. I mean, a lot of our patients, they smoke a cigarette before they walk in, but we got to meet them where we're at. We're not going to go in on the first day on their consultation, tell them, by the way, that cigarette that you're smoking right now, it's killing you, and it's probably the reason why you're having all these issues in your body. That's not what we're going to do. We're going to meet them where they're at, and we're going to educate them. Right? And education is not about shaming people. It's about telling them stories, right? This is what I've done as an individual to stay healthy. You should try it out, because people are scared. They've never met other people like us. And education and sharing your story, this is what I've done healthy. I think that's the one thing that's going to change the perspective, the paradigm.
And caring, I mean, that's a way of caring about people by meeting where they're at. What do you think?
Absolutely. Going back to what he was saying, and us as a provider office, putting ourselves out there because you only need also one person, right? This person can get in touch with 3 more people, these 3 more people, and share the message, right? So we can, for example, things that we do in the office, and if wherever you are in the nation, you have your chiropractor, this chiropractor hosting workshops. What are they going to be talking? For example, we have heart health coming up right now for Valentine's and all this good stuff. And then be like, hey, doctor, or, this is what are you going to be talking about at this workshop? And the doctor or the assistant could be like, I think you should bring your husband. I know you mentioned something. It's us too inviting them, because it's hard too. We can say all this stuff, but it can enter one ear and the other. But you got to start having conversations and giving options where can I get this information? And then you let the person decide, going back to what you were saying, because we're not doing any better if we're just telling people what to do.
And care about them no matter what their decision is.
So that's your choice. That's your choice. Whenever you get to the point where you cannot stand anymore where you are at when it comes to your health, talk to me again. Ask me what I've been doing. And I think people are going to get to a point where they keep getting unhealthy and they keep getting sick, and the choices that they're making, they're not getting them anywhere. At some point, they're going to say, you know what? I tried everything. Heck with it. Let's try this one thing. I mean, we see it with patients that are staring at the barrel of death. It's like, at this point,
Let's try anything.
let's try anything.
Right.
And that's a perfect moment where we jump in and say, this is what I've done.
Well, hopefully, sorry, go ahead. What were you
No,
saying?
no,
get to that point.
The last thing that I was going to say RFK doesn't get elected. I just want the platform for myself. This is for me, and I know my family, him, where I can have access to him. Like, say he doesn't get elected, but I do want to be able to go on Facebook or go, I don't do Facebook, but go to YouTube, go to listen to a podcast, and I can hear the guy, what is this guy doing? What is the research that he's doing? Because the second that someone gets in the way and I cannot access that information, then we have an issue. Why are you trying to, why can't I listen to him? Yeah. What is the biggest secret? What is it that the can of worms that you don't want me to open? What is in it?
Right.
People are going to question it. And also, I think people are always looking for the shiny new thing.
Yeah.
But a lot of the stuff that RFK talks about and what us natural healers talk about, it's going back to the basics. And sometimes it sounds so basic that you question
can't
it.
Be true.
It's like, can't be true. It has to be this new pill that there's billions of dollars behind it.
Yeah.
And sometimes staying healthy and being healthy is as basic as walking or sleeping and drinking water, just going back to the normal stuff, going back to caveman days.
It's so true. And hopefully with more and more information coming out and you guys sharing your thoughts and stuff, hopefully less and less people have to make it till the fact that they're so sick that it's hard to come back from.
Amen.
And so that's what you guys are all about with chiropractic care, preventative health.
Yep.
And so hopefully what you guys are doing, I know it's making a difference, but preventative health, I mean, it's going to change things.
This is it. I'm telling you. Well, we've seen it even with chiropractic care. The amount of chiropractors are graduating. It's an alarming rate. A lot of more offices popping up, a lot more holistic practitioners. So there's a trend happening, and I'm excited. I mean, Joe Rogan. Probably 5 years ago, the people that were in Joe Rogan are now the same people are today.
That's awesome.
They're great
Very
conversations.
cool. Well, it's happening.
Let's end it. Woo!